All right, so we're diving into testosterone therapy today.
You sent over this lecture by Dr. Khera.
And wow, over 100 published articles? This guy's legit.
Yeah, he's definitely one of the leading voices in men's health right now.
No doubt. So think of this as like testosterone 101, cutting through all the noise out there.
Exactly, because there's a lot of it.
A ton. We're talking real risks, real benefits, the latest guidelines, the stuff that actually matters.
Empowering you to take control of your health, basically.
Exactly. And one thing that really struck me, Dr. Khera mentioned, how many guys just start testosterone therapy without even a blood test first?
Right.
It's like, whoa, hold on.
It's a real concern. And it highlights why it's so important to understand the potential risks. Yeah. Dr. Khera, he has this really interesting approach. He looks at the FDA label, the American Urological Association guidelines, and the endocrine guidelines.
So it's like 3 different perspectives on the same thing.
Exactly.
Why is that important? Like, why should we care what these different guidelines say?
Well, think of it this way. The FDA label, that's like the official rule book, right? It lays down the law.
Okay.
The AUA guidelines, those are more like expert commentary based on the latest research.
You bet, expert commentary.
And then the endocrine guidelines, they take this broader view looking at hormonal health and your overall well-being.
Gotcha. So it's like getting the full picture from different angles.
Exactly.
Awesome. All right, let's tackle some myths then.
Let's do it.
First up, the big one, blood clots.
Okay.
Because, even the androgel label mentions potential link, and that's kind of scary, right?
It's understandable to be concerned, but it's important to look at the context.
Right.
The FDA label mentions it based on, anecdotal reports.
Meaning?
So we're talking individual cases, not big studies.
Uh-huh.
Both the AUA and the endocrine guidelines, they both emphasize that there's no solid evidence, definitively linking testosterone therapy to an increased risk of blood clots.
So it's more like, hey, we're watching this, not run for the hills.
Exactly. It's all about weighing the risks and benefits for each person, talking to your doctor,
Makes sense. All right, myth number 2, testosterone, instant heart attack.
Right.
But this is where it gets tricky because there's research on both sides. Remember that 2006 study by Molly Shores?
Oh, yeah. Yeah, that was a big one.
It found that guys with low testosterone, they were more likely to, die younger, often from heart problems.
It was kind of the game changer. People started to realize, hey, maybe testosterone has some benefits.
But then later studies were like, hold on, maybe it increases heart risk.
Right. And that's where Dr. Khera's research is so helpful. He analyzed tons of studies.
Like a zillion studies.
Hundreds. And before 2015, most of them actually showed that testosterone was either good for the heart or neutral.
Wait, so what happened in 2015?
That's when the FDA slapped a warning on testosterone products about a potential increased risk of heart attacks, strokes, that kind of thing.
Oh,
But those studies they based it on, they had some flaws. They didn't always account for other things that could be going on, like if the guys were overweight, had high blood pressure.
Right.
So it's not as simple as saying testosterone is good or bad for your heart.
Way more nuanced.
Exactly. And here's another layer, Dr. Khera. He points out that a lot of the things that increase your risk for low testosterone, obesity, diabetes, those are also risk factors for heart disease.
So it could be those other factors, not the testosterone itself.
Exactly. It's like this bigger picture thing.
It's all connected, fascinating stuff.
Yeah.
Okay, but we got to address the big one, prostate cancer.
Right. Yeah.
There's this fear that testosterone therapy, it's like fueling the fire, right?
There is. A lot of it comes from this one study way back in 1941.
1941. We're going way back.
Yeah. But Huggins and Hodges, they found that if you drastically lowered testosterone levels almost to nothing, it made existing prostate cancer shrink.
So less testosterone, less cancer. Makes sense.
Yeah. But that study, it had limitations. Small number of patients, the methods back then weren't as good.
Right.
But that one study, it had a huge impact on how doctors thought about the testosterone and prostate cancer.
So for years, it was like, don't touch testosterone if there's any prostate issue.
Pretty much, yeah. It created this fear.
Wow. But thankfully, we know more now, right?
We do. And Dr. Khera is challenging those old assumptions. He talks about this thing called the prostate saturation model. It's really interesting.
Okay, prostate saturation model. I'm all ears.
Think of your prostate like a sponge. It can only absorb so much testosterone before it's full.
Full saturated, okay.
So even if there's more testosterone in your blood, once the prostate's full, it can't take any more.
Like a glass of water, you can't overfill it.
Exactly. So just because you have higher testosterone in your blood doesn't automatically mean higher prostate cancer risk.
The prostate's like, I'm good, I'm full.
Right. And Dr. Khera, He's got research to back this up. There was this study by Dr. Shally Bosson. They gave men these huge doses of testosterone, 600 milligrams.
That's a lot of testosterone.
It is. And guess what? No spike in their PSA levels.
The PSA.
Oh, sorry, prostate-specific antigen.
Right.
A protein. High levels can be a sign of prostate cancer.
Gotcha. So no spike in PSA, even with all that testosterone.
Exactly. Pretty significant.
Wow. So it's not just more testosterone equals more cancer. That's a relief.
Exactly. Much more complex than that.
This is huge for guys who are worried about testosterone therapy because of the prostate thing.
It is, but of course, more research is always good, right?
Always. But it seems like the link between the two is, again, more nuanced than we thought.
Absolutely.
All right, let's shift gears a bit. Talk about another aspect of men's health. Fertility.
Okay.
It doesn't always get the attention it deserves.
No, it doesn't. And it's crucial for men of all ages, but especially younger guys thinking about testosterone therapy.
Right. They might still want to have kids.
Exactly.
So let's be blunt. What's the deal with testosterone and fertility?
In a nutshell, testosterone is a natural contraceptive.
Whoa, really?
Yeah, it can really lower your sperm count, sometimes even to zero, which is called zoospermia.
Zero sperm? That's a big deal.
Yeah, it is a big deal. And it's not always talked about openly. Dr. Khera sees patients all the time who started testosterone therapy and had no idea.
Man, that's rough. So if you're thinking about starting a family, testosterone therapy might not be the way to go.
It's definitely a conversation to have with your doctor. Weigh the benefits against the impact on fertility.
Absolutely. So what options are out there for guys who want to boost testosterone but also protect their fertility?
There are some alternatives like clomiphene citrate, sometimes called Clomid, and HCG.
Okay, yeah, those ring a bell. So clomiphene citrate first, what's the deal with that one?
So it was actually first developed for female infertility, but it can raise testosterone in men too. It's what we call an off-label use.
Off-label, is that like risky?
No, not risky in this case. It just means it's used for something other than what the FDA initially approved it for.
Yeah.
But it's considered safe and effective when used correctly, of course.
Got it. Okay. So how does it actually work for guys?
Basically, it blocks estrogen in the brain. So your brain's like, hey, testosterone's low, and tells the pituitary gland to release more luteinizing hormone and follicle stimulating hormone.
Those are mouthfuls. And are those hormones involved in, making babies?
They are, yeah. LH and FSH, they basically tell your testicles to produce more testosterone naturally.
Okay, so it's like a chain reaction, block estrogen, boost those other hormones, boom, more testosterone.
Exactly. It's like tricking your body into upping its game.
I like it. Okay, what about HCG? That's a pregnancy hormone, right?
It is. Yeah, human chorionic gonadotropin. Sounds weird, I know, but it's structurally similar to LH, that messenger hormone we talked about.
The one that tells the testicles to get to work.
That's the one. And unlike testosterone therapy, which can sometimes shrink the testicles, HCG can actually help them maintain their size.
Okay, that's good to know. So with HCG, it's like giving your testicles a pep talk instead of replacing their job entirely.
Exactly. It's more about supporting their natural function.
Interesting. So for guys worried about fertility, both of these, clomiphene and HCG, they're potential options.
They are, but just like anything, they have potential side effects too. So it's crucial to talk to your doctor, figure out what's right for you.
Absolutely. Always good advice. But before we even go down that road, what about just giving our bodies what they need naturally? Lifestyle changes, that kind of thing.
Dr. Khera is a huge advocate for that. He calls them the 4 pillars of testosterone optimization: diet, exercise, sleep, stress reduction.
The 4 pillars, I like it. Sounds like a recipe for a good life in general. Let's break it down. Diet first. What should we be focusing on?
It's all about balance. Fruits, vegetables, lean proteins, healthy fats, like you'd find in Mediterranean diet.
Okay, so lots of color, good fats from things like avocados, olive oil.
Exactly. And just as important as what you avoid, processed foods, sugary drinks, too much alcohol, those can really mess with your testosterone.
Got it. So it's a 2-pronged approach. Eat the good stuff, ditch the bad stuff.
Pretty much.
Makes sense. All right, exercise. We all know it's good for us, but what's the link with testosterone specifically?
So exercise, especially resistance training, lifting weights, that kind of thing, it's like a signal to your body to produce more testosterone.
Time to hit the gym.
And the more muscle you build, the more testosterone you're likely to produce.
Okay, so lifting's key. What about cardio?
Cardio's still crucial, don't get me wrong. It's great for heart health, and that's important for healthy testosterone too.
Right, it's all connected.
Exactly. It's about keeping your whole system in good shape.
Gotcha. All right, pillar number 3, sleep. We all love a good night's rest. But how important is it for our testosterone?
It's crucial. When you sleep, that's prime time for testosterone production. That's why your levels are usually highest in the morning. But when you're sleep deprived, your testosterone takes a hit.
How much of a hit are we talking?
Dr. Khera found that even just 1 week of not enough sleep, like 5 hours a night, can drop testosterone by 15%.
15%? Wow, that's significant. So skimping on sleep is like sabotaging your testosterone.
Pretty much, yeah. And it's not just about the quantity, it's the quality too. You want deep, restful sleep.
No more scrolling on my phone in bed. Got it. Prioritize those ZZZs.
Exactly.
Okay, last but not least, stress. That's a big one. How does stress affect testosterone?
Stress releases cortisol, and cortisol is like the enemy of testosterone.
Cortisol, the testosterone killer.
Basically, yeah. When cortisol's high, testosterone tends to be low. They're like on opposite sides of a seesaw.
So how do we fight back? How do we keep cortisol in check?
That's where stress reduction comes in. Meditation, yoga, deep breathing, spending time in nature.
Sounds nice, actually.
Right. Find what works for you and make it a priority. Your testosterone will thank you.
All right, so we've got our 4 pillars, a blueprint for boosting testosterone naturally. But what if you're doing all that and your testosterone is still low? Is therapy the only option?
Not necessarily. We talked about clomiphene citrate and HCG earlier.
Right. Those could be good alternatives, especially for guys who still want to have kids.
Exactly. And speaking of fertility, Dr. Khera's research on using HCG while on testosterone therapy to potentially preserve fertility is really interesting.
Wait, so you could have both, maintain testosterone and fertility?
That's the hope, yeah. Remember how HCG acts like LH, telling the testicles to produce testosterone?
Yeah, the pep talk.
Right, so it's not just about boosting testosterone, it's also about preventing the testicles from basically going into hibernation mode, which can happen with traditional testosterone therapy.
Hibernation mode, what does that even mean?
So when you introduce testosterone from the outside, your body's like, hey, we're good, no need to work so hard, and the testicles might start producing less testosterone on their own.
Which at first might sound nice, like less work for the testicles.
Right, but long term, not so much. If they're not active, they can shrink and sperm production can plummet.
Okay, that makes sense. So HCG is like, wake up guys, we've still got work to do.
Exactly, it helps them stay active, keep functioning.
Wow, so with HCG, you're potentially getting the best of both worlds, maintaining testosterone levels and fertility.
It's promising, but we still need more research to see how effective it is in the long run.
Of course, it's still early days, but it's exciting to see this kind of research happening. And speaking of the future, Dr. Khera also talks about some really futuristic stuff like nanotechnology and stem cells. That's next level stuff.
It is amazing. With nanotechnology, imagine like a tiny chip, smaller than a grain of rice, implanted under your skin, and it releases a precise dose of testosterone.
So instead of those peaks and valleys you get with injections or gels, it's like a steady stream of testosterone.
Exactly. No more roller coaster, no more remembering to apply gels or schedule appointments.
That would be a game changer for sure. Okay, but stem cells, that's like sci-fi stuff. How would that even work for testosterone?
It's still early days, but the potential is huge. Imagine regenerating your own testosterone-producing cells.
So like turning back the clock on your hormonal health?
Exactly. Dr. Khera is really excited about the work of Dr. Ranjit Ramasamy, who's doing some groundbreaking research on Leydig stem cells.
Leydig stem cells, those are the ones that
produce testosterone. They can turn into Leydig cells, which are like the testosterone factories in your testicles.
Okay, right. So theoretically, you could take these stem cells, inject them into the testicles, and boom, they start producing testosterone again like they used to.
That's the hope. Instead of just supplementing testosterone, you're restoring your body's natural ability to produce it.
Wow, that would be incredible. But it sounds like this is still a long way off, right?
Yeah, stem cell therapy is still in its early stages. There are a lot of challenges to overcome.
But it's definitely something to watch, something to be hopeful for. Man, this deep dive has been packed. We've gone from blood clots to stem cells.
It's a complex topic, but that's why it's so important to talk about it, get the information out there.
Absolutely. And one thing that's really come through is that it's not one size fits all, right? Dr. Khera emphasizes personalized medicine when it comes to testosterone.
100%. Every guy is different. Different medical history, different lifestyle, different goals. What works for one might not work for another.
It's like finding a good suit. It needs to be tailored just right.
Exactly. And that's why having a good doctor who understands all this is so important.
Couldn't agree more. This has been fantastic. Any final thoughts before we move on?
Just remember, the more you know about testosterone, the better equipped you are to make good decisions about your health. And never underestimate those 4 pillars we talked about. They're the foundation.
Love it. All right, listeners, we're going to take a quick break, but don't go anywhere. We'll be right back to wrap things up. Going through all this, it's clear testosterone is about way more than just, muscles and libido.
Oh, absolutely. It affects your energy, your mood, even your thinking as you get older.
It's like this hidden force behind so much of how we feel every day.
And it's not just testosterone working alone either, right?
Right.
Dr. Khera talks about how it's all connected, this whole web of hormones and systems in your body.
Give me an example. What else is involved in this testosterone tango?
Well, your thyroid, for one, your vitamin D levels, even the bacteria in your gut, they all play a role.
It's like this delicate balance. Everything needs to be working together.
Exactly. It's not just about chasing a specific number on a test. It's about creating an environment where everything can thrive.
Which brings us back to those 4 pillars: diet, exercise, sleep, stress management.
Right. They're not just random tips. They're the foundation.
It's all about creating that hormonal harmony long term.
Exactly. Sustainable changes. That's the key.
So as we wrap up this testosterone deep dive, I keep thinking about those futuristic possibilities Dr. Khera mentioned. Nanotechnology, stem cells.
It's pretty wild to think about, right?
It is. Imagine not just treating low testosterone, but maybe even extending lifespan with these technologies.
Wow, that would be something else. Feeling good and living longer. That's the dream.
It's definitely food for thought. But in the meantime, for anyone listening who wants to learn more, talk to your doctor.
Absolutely. They can help you figure out what's right for you, personalize your approach.
Couldn't have said it better myself. This has been an awesome deep dive into the world of testosterone. It's been a pleasure.
And listeners, remember, keep asking questions, keep learning, and until next time, stay curious out there.